California's Medi-Cal asset test is back. Hello, I am Kevin Knaus with InsureMeKevin.com, an independent health insurance agent in California. And California has passed their 2025-2026 fiscal year budget, and they brought the asset test back for non-MAGI Medi-Cal programs. And the Department of Healthcare Services, which oversees Medi-Cal, it's the counties that actually do the eligibility and enrollment for the Medi-Cal programs, but they put out the letter that says the reinstatement of asset limits for non-modified adjusted gross income, non-MAGI, Medi-Cal programs has been reinstated. And so what does that look like? Well, for 2026, an individual can have no more than $130,000 in, cash, stocks, bonds, liquid assets to pay for healthcare services and health insurance premiums. Now, they will give a family an additional $65,000 for each member within the household. So a married couple can have no more than $195,000 in those assets. If they have more than the limit, they need to spend it down. Otherwise, they will not be enrolled in that non-MAGI Medi-Cal program. And what does this apply to in California? Well, it applies to the long-term care, the skilled nursing waiver that some people get because, they're disabled. They're in a skilled nursing facility. The Medicare Savings Program, which people oftentimes refer to as being dual eligible for Medicare and becoming eligible for Medi-Cal. And it is Medi-Cal that can pick up the costs of the Part B premium and potentially the cost sharing of original Medicare. And that's significant for many people. And there's some other programs that it also applies to. Now, what I really want to emphasize is what this does not apply to. This asset test does not apply to covered California Medi-Cal enrollments. That is considered modified adjusted gross income Medi-Cal, and that is the expanded Medi-Cal of the Affordable Care Act, and the MAGI Medi-Cal program, generally for people who are under 65 and don't qualify for Medicare, is based solely on your income. No assets are considered. This also does not apply to the asset limitations, does not apply to disabled adult children, the disabled widow program, and PICL eligibility. And if you're PICL eligible, you know what I'm talking about. So when people go through and they need to fill out the application in 2026 or the renewal, the county is going to ask for, your assets, but things that will be excluded are the primary home. Your primary residence is not counted. You can have one car, furniture, personal items. There are certain burial funeral trusts that are not counted towards meeting that $130,000 limit, and ABLE accounts, which is an IRS designation that allows funds to be put into a ABLE account that can grow tax-free. And you can learn more about that. There's a Cal-ABLE program. So what will happen is if the county determines that you have too many assets, too many liquid assets, you have to spend them down. And they'll need to spend down in order to qualify for the program. And maybe that might be where the ABLE account comes in if you're able to open one of those up. But one example are Medicare beneficiaries that meet the income test, the monthly income test, because maybe all they have is Social Security income, but they, maybe have some cash in the bank, and back in 2023, you couldn't have virtually any cash. I think you had to spend it down to $2,000. Then it went up to $130,000 in 2024. In 2025, there was no asset test, but now that is coming back in 2026. So if someone had $160,000 in the bank, to be eligible for that Medicare Savings Program, where Medi-Cal might pick up that Part B premium and original Medicare cost sharing, the 20% on the Part B medical health insurance, the individual would need to spend down $30,000. Of course, that would be different if it was a married couple. Now, the implementation of this, if you are applying for one of these non-MAGI Medi-Cal programs in 2025, they're not going to be considering your assets. You're good to go. What's going to happen is that when you are renewed, when they look at renewing your non-MAGI Medi-Cal eligibility in 2026, which happens generally 12 months after you first come into the program, they will look at your assets. They also mention that if there's a change to the household and there was no asset information because you applied in 2025 and maybe your income went down or it went up a little bit, they're not going to look at it. They will look at your assets at the renewal time. Now, beginning January 1, 2026, if someone applies for a non-MAGI Medi-Cal program, the long-term care or the Medicare Savings Program, yes, assets will be considered. And there's a whole packet, it's like 37 pages of stuff you have to fill out. And this is not black or white. It's not cut and dried. The calculations for the income and the assets and the conditions can be complicated. So do not be dissuaded from applying. If you don't apply, you'll never know whether you are eligible. If you're denied, okay, what can I do to become eligible? But oftentimes people have income, I make too much money. No, the way Medi-Cal looks at it is they reduce your monthly income for certain expenses, such as if you're a Medicare, they will reduce your income by the Part B premium of $185. Not all assets will be included in tallying up to see if you're over $130,000. Some stuff may be in a trust that you can't touch. Other things may be, you just don't know. You need to give the information to the county eligibility worker. If they come back with a denial, you can appeal, and I do know people that have appealed that their assets were too high, and they went back and said, no, you don't understand that my Schedule E or whatever it happens to be, it's not what you think it is. And once it is explained to the county, they go, oh, okay, yes, you are underneath the limit. So always apply and see where it goes, because again, this stuff is complicated. But the big thing is that for 2025, there was no asset test, no limitations. But in 2026, this asset test is coming back, and it'll be no more than $130,000 for an individual to qualify for non-MAGI Medi-Cal programs. If you have any comments or questions, you may leave those down below, and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.